afternoon, good evening, good day, wherever you are joining us from. It's always lovely to see you guys. Thank you for accepting the invitation to participate in our very special event. This is a very special event for us, and we needed to invite all the people that we know in the sickle cell community. For those people that haven't joined us before, my name is Agnes Sinsofan. I'm the founder and the executive director of Australian Sickle Cell Advocacy. We have the Portuguese team, and I'm going to allow you to speak your language. We're supposed to have someone to translate for us, but if they're not here, we have Dr. Armando, who's able to translate and give us a summary at the end. So Eunice, please take it up. Thank you.
Hello, everyone. I'm Eunice. So I'm 3 little prince boys, who's the last one is sickle cell anemies. It's been 14 years on this journey, and I never thought of living this kind of experience. So I learned a lot of many things on this journey, and it's a pleasure to be here to to learn more about sickle cells. So now I will speak in Portuguese, is more comfortable for me. E Dr. Armando aqui vai fazer a tradução, não é? Neste momento eu sou a presidente da APAFA, que é a Associação dos Pacientes da Anemia Falciforme em Angola. A nossa associação tem como objetivos apoiar as pessoas com anemia falciforme no nosso país, como melhorar a qualidade de vida dessas pessoas, permitir que elas tenham o fácil acesso ao atendimento nos hospitais públicos e privados. A nossa associação também pretende fazer advocacia e dar empoderamento ou dar poder às pessoas para que tenham acesso aos medicamentos específicos da anemia falciforme, ou então que esses sejam isentos de pagamentos. Dos objetivos também é tornar a pessoa portadora da anemia falciforme com identificação específica para que, no caso de uma crise aguda, ela possa ter acesso rápido, atendimento rápido nas instituições hospitalares, quer essas também públicas ou privadas. Promover eventos nacionais e internacionais, celebrar parcerias com instituições nacionais e estrangeiras. Aqui nós estamos a contar com ONGs internacionais. Apoiar esses pacientes a terem acessos a esses atendimentos hospitalares, assim como ter uma garantia nas instituições por questões laborais, ou seja, há situações de o paciente de anemia falciforme muitas das vezes ser estigmado nas instituições em que labora e ter lidar com difíceis situações laborais. Então nós pretendemos também atuar nesta área com a parceria das instituições estatais. Não sei se agora deixaria a doutora Armando aqui fazer esta pequena tradução. Está cortado o som, doutor Armando.
I'm asking you, there is a translator.
Pelo que eu percebi...
Yara was supposed to organize that. I can't see anyone. So please go ahead. Don't worry about us. You can summarize for us at the end.
Okay. No, she said that she is the president of the Sickle Cell Disease Association in Angola. They have a lot of goals, a lot of objectives. One of them is to educate all of people with sickle cells and to promote and working with the government to allow these people with sickle cell to have health assistance and to promote international congress and these all things to help the people with sickle cell disease and to reduce the incidence of sickle cell disease in Angola. And they're trying to work with the government and non-government organization. These are the main goals of the association.
Thank you for that.
Okay.
Eu gostaria, doutora Armando, gostaria de perguntar à Agnes, nesse painel, nós estamos sozinhos, não temos participação das outras instituições, com quem dialogar, trocar impressões?
Agnes, she's asking if there is all the colleagues that are participating in this event, or they are only Portuguese speaker in this event. Because she would like to share experience with all the colleagues of all the countries with what they are doing.
No, go ahead, because this is recorded, so we'll be able to share it afterwards. Just go ahead. That's why we're having it recorded. Thank you.
Okay.
Okay.
I'm good. Okay. Bon, I sent in a presentation. I don't know if you have it is available, but I'm going to.
You can be able to share screen. If you have it, you are able to share screen yourself. Do you want me to run them for you, or do you?
Yes, if you is available there, my presentation.
Let me find it. Let me find it for you.
Yes. But if it's not available, I can speak.
No. I can find it for you. But if you have it, you can also run it yourself. You can share screen. But let me find it as you are talking. I'll find it for you. Are we sharing the one in Portuguese or in English?
The English.
Okay.
But if the English is not possible, we can use Portuguese, the Portuguese one.
I have both, so take your pick. So I have the Portuguese version, which is this one.
Okay, thanks. For everybody, my name is Antonio Armando. I'm from Angola. I work in the health minister, and I'm a national coordinator of non-communicable disease. And sickle cell disease is one of the diseases that belongs in non-communicable disease department. As you know, next please, as you know, sickle cell disease is a health problem because the prevalence of people with this disease is very high. And in our country, for example, 2.4% of newborn have sickle cell disease and 18% have trait of sickle disease. That's why in our perspective, please, next one, because I have only 5 minutes to speak. Next, please. The sickle disease is a public health problem in our country because the number of people with sickle disease is very high and the transcendence of this disease is high too. That means there are a lot of people that are dying with this disease, specifically under 5 years old, and they have a lot of comorbidities that allow them to stay longer time at the hospital. And fortunately, there are some approach that can reduce the mortality and the transcendence of sickle cell disease. These approaches are, for example, screening, education, and treatment. Treatment, for example, with hydroxyurea, that we have enough evidence that work, and improve the quality of life of these people with sickle disease. And fortunately, we have an international commitment for sickle cell disease. And this time we are living now, for example, for this conference that is every time now is an evidence that there is an international commitment. And we like to thank Agnes for giving us this opportunity to speak about this topic. That's why the Minister of Health designed, next please, a strategic plan as a document that's going to guide all of work about prevention, about treatment, about the control of sickle cell disease in our country. Next, please. And our vision is to be a national and regional reference in prevention and control of sickle cell disease. This is our vision. Our mission is to be responsible for all sickle disease integration action of prevention, screening, healthcare, and epidemiological surveillance in Angola. We have as value commitment, respect, competence, and responsibility. Next, please. In our strategic plan, next, please, Adam, we have 6 strategic objectives. The first one is educate the people and raise awareness, because in our point of view, education is very important, because if the people are educated and they know the condition, they are going to, for example, avoid to have children with sickle cell disease. But it helps too for people that have sickle cell disease to have control of the symptoms and to look for healthcare when it is necessary, to take, for example, vaccine and not and all of these things. In our point of view, education is very, 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 very important. And we have a lot of activity, for example, to produce material that are going to help to improve the literacy of our people in the school and in the service, the hospital service, specifically in the primary care. The second one is implementing the screening, because the screening is important, because if we know in advance premature that the people or the children have sickle disease, he will be sent to the primary care to take all of protocol that are necessary for these children. And the third one is the prophylaxis and treatment of children with sickle cell disease. For example, these children have to take vaccines, for example, vaccine for pneumonia, antibiotic under the age of 15. And these people with this condition must have access to the health service, specifically in primary care. And we are planning to introduce for 15% of all of people with sickle cells access to hydroxyurea. Next, please. And the fourth one is the care for pregnant women, because we know that pregnant women, when women with sickle cell disease, when they are pregnant, they face a lot of problems. And sometimes when they go to the health facilities, they have some problem, not last one. Yes, when they go to the hospital, sometimes they find physicians that are not, they don't have enough knowledge how to deal with these women. That's why we are promoting this problem. And one of our activity is to elaborate manuals of orientation how to deal with women with sickle cell disease that are pregnant, and to try to build a kind of reference of these women in high-level hospital to take care of these women. And the fifth one is, number 4 is a surveillance, because we need to collect the data of to know how many people that we have with sickle cell disease, and it's going to help us to monitor and to implement new plans and to have the real needs of people with sickle cells, because the number are very important. In last one of our objective is to identify and establish partnership with agents who can help us to finance a lot of the majority of our objective, because the health minister have a lot of problems to solve, and sometimes they have not enough resource. That's why we think that partnership is very important. We had a very good experience here in Angola with Chevron. Chevron helped us to do a screening in 2 provinces, and this screening helped us to have data, for example, the prevalence of people that with children that the newborn with sickle cell disease. This is our 6 main strategic objective. We think that with implementation of these 6 objectives, we are going to reduce the incidence and the mortality and the morbidity of sickle cell disease in our country. Next one, please. I think that next one, the last one, Agnes, I think there is, Agnes, the last one. I put this picture because all of us know that once Martin Luther King had a dream. When I have a dream, all of us know these sentences. And in 2009, Barack Obama was elected president. I think that he achieved the dream of Martin Luther King. Our dream is one day to have less patients with sickle cell disease, and people with sickle cell disease to have access for medical care and all of field they need. I think that with this word, I finish my presentation, and I thanks Agnes. I thank the all of colleagues, all of people that are involved in this conference for this opportunity that are giving us to talk about the strategic plan of our country. Thanks.
Thank you so much, Dr. Armando and Eunice. If there's anything that you want to share, please go ahead. I don't have any question. I've got a, no, that's fine. I don't have any questions at the moment, but Eunice, did you want to share anything after that presentation? Thank you.
Apenas acrescentar que nós temos estado a fazer diagnóstico do número de pacientes com anemia falciforme pelo país. Tão logo nós tenhamos esta estatística, não é, pelo menos a 80% ou 90%, vai nos ser bastante útil para podermos usar, não é, para tocar as pessoas das instituições a quem nós estamos a pedir apoios para saberem a quantidade de pessoas que têm necessidade de ajuda. Doutor Armando. Doutor Armando. Ficou sem comunicação.
Is he mute or is he dropped off? Well, there's a challenge, Eunice, you have to translate.
Yeah. Yeah. So we are trying to account how many people we have with sickle cells. That can help us to demonstrate the organization, how many people need help. And there's so many families have so many difficulties to have the medication and to have the care of the hospitals. We know how we have so many problems in Africa. That's why we need help to help these peoples. So many children without medication. That's why we are trying to account how many people needs this help. We are trying to contact all the organizations who can help us. We are fortunate because we can count of the Dr. Armando, Dr. Adis work with us. Every time someone who needs help, they are there to help them. And what else? If I speak more English and I can speak more, but I need your help, Dr. Armando.
You did very well. I think
Yeah.
I was able to understand that, and we have a few people who joined us as well. So you did very well. Well,
Thank
we've
you.
been warned that this session has got 5 minutes, about a minute to go. And we
Yeah.
just want to thank you for accepting our invitation all the way from Angola, speaking in your own language, and hopefully
Yeah.
we'll have more Portuguese people who are going to see this session. We have
Mhm.
the slides that we have in English, which we are going to share with the team. So thank you so much for joining us, Eunice and Dr. Armando, and our regards to Dr. Adis, who was not able to join us today.
We thank you, Agnes, to invite us. It's my first time on this journey, and it's a pleasure to be here and learn more. And we wait for a next time to have again another invitation for this. Okay, so thank you for the invitation.
Thank you so much. You have a nice day. We're just winding up here, and your day is just beginning on the other side of the world. So thank you so much for joining us again.
Thank
Good
you
day.
for you too.
Thank you.
Good day for you too. Thank you, Agnes.
Okay. Thank you, everyone, for joining us. We'll go to the next session now. Bye-bye.